Welcome to Health+Tech, the show where we explore the law that applies at the intersection of healthcare and technology. Your hosts, Janice Suhita, Andrea Linna, and Jonathan Ishee, are healthcare attorneys and partners at McGuireWoods LLP, a law firm of 1,100 attorneys with offices throughout the United States and the world.
Hi, everybody. Welcome to the Health+Tech podcast. Today, we have the pleasure of having as a guest Zack Perry. Zack is the president of AHIOS. Zack, do you mind kind of giving us a little background of AHIOS and what AHIOS does for their clients?
Yeah, of course. And thank you for having me. So first and foremost, AHIOS is the Association for Health Information Outsourcing Services, a bit of a mouthful. But we are a group of over 20 companies across the country that work on behalf of healthcare providers, so covered entities, helping them to disclose confidential patient information. So we work with healthcare providers across the country, whether they're hospitals in the acute care setting or physician practices in the ambulatory setting, with the ultimate goal of helping them receive and fulfill requests for patient information.
Very cool. So what are some of the topics that you guys focus on? How has the mission really changed over time? I'd love to hear more about that.
Yeah, so AHIOS has long roots in the health information management community. So within HIM, we are an outsourced service for the healthcare providers. So for a long time, AHIOS, and still today, we focus on education, right? Education, because the fulfillment of medical record requests is a complex and regulated activity. So there's always been an aim to align ourselves with the HIM community and provide the best possible education we can. And we view ourselves as a cost savings, right? The business model we employ as AHIOS member companies is to work with healthcare providers as our clients, but through helping them to release confidential information to third parties, we typically charge those third parties for the information itself. So we're not really charging the healthcare provider historically. So it's a educational, community, and it's also a cost savings for healthcare providers. So that's historically how AHIOS has operated. I would say over the past few years, AHIOS has become much more involved in the advocacy efforts around patient access to medical information, patient privacy. So the mission itself has maybe started to bend more towards how to navigate in a ever increasingly complex digital world, how to fulfill the service that we provide, while we're still viewing ourselves as an educational partner. But again, just taking on a more active role in that advocacy around how the world sort of looks in the future, right? Because, what we did used to be based in paper charts, so it was a lot easier to protect data when it was in paper format. And as we've seen, the very appropriate digitization of the healthcare record universe, that has just introduced new risks, new workflows, new processes. And so I think that we have sort of tried to lean into what that world looks like now that there's so much more data out there, and so many parties that are using it and requesting it.
Thanks. So, Zack, I know since this is an area for your members, one of the biggest issues that's come up is this proposed notice proposed notice for rulemaking for HIPAA and the changes that are in the NPRM. For those who are watching who aren't familiar with what I'm talking about, back in December of 2020, the Office for Civil Rights published a NPRM related to proposed changes to HIPAA. There was a comment period that ended earlier this year, and now OCR is in the process of finalizing that rule. So, Zack, within that NPRM, what are the areas that you are most focused on, and what is the you and AHIOS are most focused on?
Yeah, Jonathan, you said a lot just there. The the notice of proposed rulemaking was a big event for our industry. I became president of our organization in October of 2020, and this came out in December of 2020. And so while we were in the midst of still navigating what it meant to operate remotely in a COVID world, this came and suddenly our focus had to shift to it in a pretty meaningful way. And there's a number of aspects of it, but let me try to hit a few, and then we can dig into maybe one or two of them. I think that my overall thought around the NPRM is there's a lot of good intentions in there, right? I mean, we are right now in a dynamic where we're trying to figure out how to manage patient access and patient privacy. That's where we are, right? And there's sort of this battle going on between how do we make sure patients get access to their information, and how do we then make sure that there's some level of control over other people or other parties getting access to that information and potentially using it for reasons that the patient's not aware of. So, this NPRM in a lot of ways does a lot of good for patients to get access to their information. And speeding up the timelines as a good example, right? Right now, covered entities have 30 days to respond to a patient access request. Reducing that down to 15, that makes all the sense in the world to me. The truth, though, is that most of our member companies operate in single-digit days in terms of our turnaround time expectations. So while 30 to 15 sounds like a big reduction, we're already kind of living in that reality. So that's not something we wouldn't support. The second piece, though, is the privacy, and I want to try to reframe privacy a little bit, because privacy is sort of a nebulous topic. But privacy is to me is really about access control, right? And so it's sort of strange. Why is this group of outsourced companies that handle medical record requests talking about patient privacy? Well, when you think about patient privacy as access control, and our member companies being the last ones to touch these records before they leave the four walls of the healthcare institution, suddenly it starts to make a little bit more sense, because our companies are on the front lines of seeing this every day. We see the true stories of third parties purporting to be the patient, or trying to get access to information or more information that they might otherwise be entitled to. And you have to remember, a lot of these third parties are not covered by HIPAA, right? So once this information leaves the covered entity, once it leaves the business associate, which is what the AHIOS member companies are, it sort of is just out there at this point, right? And there's not a whole lot saying exactly what can be done with that data. And so when I talk about patient access, AHIOS is on the side of more patient access 100% of the time. But we do still want to maintain that access control. And I think what access control looks like in the world today is consent around your data being released, right? And having not just consent, but informed consent, right? So it's not about limiting information that patients want to see, given to other parties. We are all patients, right? We all want information to flow freely. But we do want to make sure that the information doesn't end up in hands of people that shouldn't have it. And we see it every day. We see signatures that look a little too digital. They don't look like real signatures sometimes when we see this. There was an example, a few examples recently where there were actors purporting to work and request records on behalf of pharmacy companies. And there were actually celebrity names and signatures that were at the bottom of the authorizations. And so those are the types of things that we see as HIPAA member companies. And, it's an interesting perspective, right? Because, at an individual healthcare institution, you might not see the broad spectrum of requests that are coming in. Even at some of our member companies who see millions of requests a year, you might not see that. But once you bubble it up into a industry association like HIOS, and we can start to share best practices, we can start to corroborate some of these stories, right? And that's why you start to say, okay, access is good as long as it's informed consent around the access to it. So, and I think that what we're going to spend time in 2022 for HIOS is sort of trying to help navigate and develop what that framework looks like. I think we've all been in a rush to download a new app and get access. We've all scrolled through those multi-page terms and conditions documents, with very few of us not reading fully what exactly the mealy-mouthed description of what exactly is being signed away when we agree to those. So I think that, what we will be focused on, and this is one of the direct tying it back to the NPRM, right? The NPRM says you must mandatorily give API access to any application that requests it, right? Whereas Cures was much more sort of narrow in their definition of API access. So I think that developing some common sense guardrails around sharing information is part of what our goal will be in this digital world. So what does that look like? One, understanding who is going to have access to my data. Number two, how are we going to be using that data? And I guess with the first point, when I say who has access to it, I guess it would also be important to know in what format, right? Because that's a new piece of this, right? There's now, it's not just necessarily still PDF documents. It can also be discrete data elements. And then one of the big ones, how are you monetizing it? Just tell me, right? Just if I'm giving you access to my patient data, to my data for free, I'm guessing there's a business model here, and I just want to know what it is. And I think that's all fair to point out to people in a really straightforward way. And maybe one of the last elements that comes to mind would be some time limitation, right? If I consent or opt in or opt out, maybe that shouldn't be perpetual, right? Maybe there should be some sort of cadence to a renewal of that opt in or opt out. So I just think that those are some of the common sense things that we're going to be working on. And then the last one with the NPRM, so right, we've talked about access, which we support. We've talked about API access, which gives us some concerns around security. There's I digress a little bit. There's another example which I think is worth mentioning. The NPRM also points out that you can make now oral requests for health information. And I'm not exactly sure how to operationalize that. And I'm not the smartest guy, but I've talked to some other really smart people and they're just as confused as I am. And so I think that is just puts people in a really tough spot, right? You get a phone call, you're assuming good intent. You're not really allowed to ask too many questions to verify the veracity of the requester. When you hang up the phone, what record exists exactly to look back to say what was requested by who and where is it going? And at the end, somebody can accuse you of information blocking. And what you have there is just sort of the unfortunate person who picked up the phone looking around going, how did this all happen to me? And so I think that's one element of the NPRM that we've talked about a lot. And I think that there's some work to do around sort of firming up or fleshing out what that would actually look like in practice. But then the last, big one I'll point out, so patient access, privacy or access control. And then the third would be just understanding the practical cost shifts that this NPRM would have on the industry. And not just our industry, but the healthcare industry in general. Right now, the business model generally is supported by third-party requesters, right? Those requesters that are making requests for commercial purposes. That's kind of how we think about that group of people or that party. So we typically don't charge patients, or we charge them a very nominal fee. We do not charge, our companies do not charge for continuity of care requests, right? So requests that are moving from one healthcare system to another healthcare system. So it's this other category of requests that are going largely to insurance or third-party attorneys. who are not in the shoes of the patient making healthcare decisions, but requesting information for other commercial purposes, right? Insurance underwriting, litigation being two prime ones, or even payers requesting information for risk adjustment and quality reimbursement. So those are some of the parties that we do charge. And under the proposed rules in the NPRM, where you have these third-party directives, right? So now the patient rate effectively gets extended to third parties. That premise, one of the major premises of the NPRM is that this is all cost saving for the healthcare system. When in actuality, if those costs are no longer borne by the third-party requesters who are receiving the information, and yet the jobs to be done don't change, right? The fulfillment of a valid authorization, the work to compile that record in the absence of an easy button. That's always one of the things I say. There's no easy button to do what we do. It's still, unfortunately, more a manual process than I think all of our companies would like. We're all working every day and month to further digitize that process, but it is still, no matter what anybody says, there are some real limitations in terms of what information sharing exists between different EHR companies. So if the jobs to be done don't change, but the fee structure goes away, well, then that cost shift also just has to be borne by the healthcare providers themselves, right? So, and that's irrespective of whether they choose to continue outsourcing, right? Because I could see the argument, right? Well, you don't have to charge the healthcare providers. That's what you're charging. That's what you're deciding to do. And I guess that's a fair critique, but somebody has to do the work still, right? And so, whether they're outsourcing it and paying for it in that way, or they're staffing up to pay for it internally, there is a real cost. So I think that just understanding the premise of the NPRM being that there's a cost savings to be realized, I don't think is fair. I don't think that's a practical reality that we understand or see. And so you end up seeing over $1 billion of costs being shifted back onto the healthcare system each year. And so one of the things that AHIOS did is commission a cost study just to sort of prove that out, right? Just to sort of, put some third-party objective rigor around that concept. And so those are some of the things that we're most focused on.
Okay, great. Yeah, I mean, there's so much great content there to follow up on, but I think something that continues to stick out to me, and I know we got connected through our recent HIPAA webinar, but just talking about, even the current rules, the request for access creates some hurdles for healthcare providers. We see right now the OCR has, the 20 settlements against healthcare companies for right of access, right? We still have clients that are still, these books have, these rules have been around for a long time, and it's still really challenging because of what you said, Zack. It's still very manual. It's still a big job to do what they have to do today, let alone all these changes around APIs and reduced deadlines and everything. So I think it's really good not only to remind everyone of what the current rules are and how important compliance is, but then to think about, okay, now we're even lifting the bar even more, and kind of what does that mean for your compliance department, and how are you staying on top of those things? And I'd love to hear, you've touched on this some, but a little bit more around the compliance threats that you still see around medical record access that would be applicable not only now, but after the rule. And you touched on a couple of things that really made me think about some work Jonathan and I have been doing on around the FTC new breach notification rule, where if you have subscribed to an app and you're sharing your medical data, what obligation do those app creators have in order to notify you of a breach, and what are the potential penalties around that? And, I just updated my iPhone today, and it reminded me of what you said about the terms and conditions. It's like 50 pages of terms and conditions. And I'm a healthcare attorney that focuses on data privacy. It's like, this is ridiculous. Like, it really is ridiculous. And people have no idea, I don't think, where their stuff is going. And I certainly don't read it. I'd love to find anyone that has ever read that other than the lawyers at Apple, right? So, that to me is, I think there's a lot there to unpack, but I'd love to hear more about what you see as kind of those new compliance threats? What should our clients be focused on right now around medical record access to make sure they're focusing on what we really see as a concern in the near future?
Yeah, I think I don't know who's read them either. That is to me one of the big shortcomings, right? It's sort of the every catch-all thing that I could agree to waive, I've now waived, and yet my information is in another party's hands. So that to me is very concerning. So I think that's one of the big ones to talk about, right? A mandatory API access for any third-party app that wants to connect to your system. That is such a massive undertaking, one, logistically. I mean, if you've ever tried to work on an integration with a health system, you will understand how backed up their IT departments are, and just trying to work through the clinical workflows that they need to do to support their business, which is providing care, let alone now introducing concepts of third-party applications that have gone through no rigorous testing through any sort of standardized body, getting access to this information. And I think there was a study that I was reading recently where a cybersecurity analyst had gone through, and this is the concept of these personal health applications or personal health records, right? These aggregated apps that take different information from, different years and longitudinally connect to your patient history, right? Everybody, when they hear that idea, it sounds like a good idea. The problem is, as soon as you ask people how much they would pay for that, most people balk, right? And I love the concept of having a full, complete longitudinal health history with me in my pocket, but I don't necessarily know if I want to pay for it. And part of the reason people don't want to pay for it, by the way, is because we actually can't read it. We actually don't know how to read our own medical record for the most part. So I think there's a real opportunity to be created around how to understand, decipher, and just make it more useful to you to have that information in your hands. And that doesn't mean going to the doctor more, right? That means finding other parties that can kind of serve as that second opinion, who are not necessarily going to be, require a full doctor visit to do it. So I think there's a real opportunity there. Back to the study. So the study had a cybersecurity analyst go through, and they were sort of trying to hack into different PHRs or PHAs, personal health records, personal health applications. And what they found was that when they went to the ones that were developed by the EHR developers themselves, there was some pretty rigorous security, and it was very difficult to actually extract a lot of data out of those. But when they went to the third-party apps, and they don't name the third-party apps for a reason, but when they went to these third-party apps, they fully informed the companies they would be doing this exercise. They were able to extract 4 million records. All they had to do, and I am not a cybersecurity expert, but this was characterized as freshman level cybersecurity type stuff that they were doing to break into these applications. And they said the records really just, the information came gushing out of them. And I think that is the risk now of having all of these third-party apps connecting into these EHR systems. There's so much data. There's the proliferation of data is in and of itself a topic. But going to these third-party apps that don't really have these rigid, robust security controls, that's a new one, right? Kind of how to manage that. While at the same time, the patient sort of wants you to release it to those third-party apps, right? So now you're kind of in this position where the patient says yes, the IT department's totally not sure this is a good idea, but the regulators are saying you have to do it. And so you kind of end up in this situation where I don't know, it's just we're going to have to figure this out, right? And that, I don't have the answers today. I don't think anybody does, but clearly there's going to have to be some more rigor around that. And because those apps fall outside of HIPAA, there was a little bit of a vacuum. I wasn't exactly sure who or what body would be responsible for it. And you've seen now the FTC step up and say they're the ones that are going to be responsible for regulating these apps. So I think that is something that we are all going to have to watch and be aware of. And, as another example, Andrea, I mentioned before, just the fact that we were able to catch, these bad actors purporting to be pharmacy brands, requesting information using names of celebrities and you could actually Google and you could go online and find the celebrity's signature, right? I mean, these are just sort of strange things that are getting introduced through digital signatures, right? So I think that's a new area for compliance to be thinking about. Is just the concept that what is a digital signature? How do you verify the veracity of that signature? I think that's something to be aware of. I don't know. Those are the ones that come to mind right now.
Those are great.
Yeah.
Yeah, and I was at a conference not that long ago, and they were talking about how your medical records are worth like 10 times what any other data is worth on the black web about you, like how valuable that information is and how many people are trying to get a hold of that information. And it was just like, wow, I had no idea.
Think about how much information is in there, right? It's not just your address. Totally. It's not just your social security number. It's all of these, relationships you have. I mean, it is incredibly, usually there's a copy of your driver's license in there. I mean, there is so much information contained in a medical record. And so that's kind of the crux of it, right? We worry as the sort of the last line of defense between that information leaving the four walls of a healthcare institution and the parties that have access to it. We worry about just this the nebulous area, right, where you can tell lots of scary stories about information, medical records on the dark web, but we see it on a regular basis. We see companies, third parties who purport to be the patient, and we call the patient and we say, did you give permission for this party to request your medical records? And they say, I've never heard of that company before. So that's tough, right? That's really tough to regulate. So on one hand, that's why I call it sort of this battle between access and privacy, because on one hand, the speed at which you release information is actually one of the core metrics and KPIs that we measure ourselves by. How quickly can we get a request for information, verify it, and deliver the information? And, I live in a world where we want that to be minutes and hours, not days and weeks, right? That is our goal. And certainly in some of these continuity of care requests, that's the expectation. So, if you are optimizing for speed, well, you're going to have to make a sacrifice on privacy at some point. And so I just worry that right now, because access has been the focus, right? Andrea, you mentioned that sort of the right of access initiative that OCR went on, right? And we've seen 20 of these different providers be named in these different whatever you call them, regulatory actions. That then starts to tell you where the government's thinking, right? The government's thinking we are unhappy with the current state of access, and that is what we want. More access is better. Well, until access becomes ubiquitous, and then suddenly the controls have been lost. So that's why we continue to kind of try to navigate this access versus privacy or access control, trying to give some language to it, right? Because privacy, again, I do think it's too nebulous, right? It's about consent around data release. And I think that if we can build some common understanding, some common language, a good framework around what does it mean to consent to your data being released to a third party. HIPAA had a lot of good stuff in it, right? The patient access versus a third party authorization, right? It's right in there. So when I think about, kind of bolstering that patient access path while also reinforcing the authorization path, and maybe putting some modern sort of, guardrails around what that means given the digital world we live in now. That is what I think, I hope that is what a lot of our clients are hoping that we're thinking about. And that's exactly what we're doing.
Yes, that's great. And I think too, to the point about informed consent, is it informed consent to scroll through 50 pages of terms and conditions, right? You know what I mean? Yeah. So I think it's such an interesting, because I'm kind of stuck in the middle, right? I write those terms and conditions, but I'm also the person that accepts them, right? So it's such a tricky kind of area because it is so complex, but you want the patient, you want the individual to understand it at the same time while protecting the company. So it's definitely tricky. Well, thanks, Zack. This is great. We could go on this topic for days and days. I know we are all in the healthcare as healthcare lawyers and working in the healthcare space, and all of us are patients. This is such an incredibly interesting and important topic for all of us in our different parts of our life. So thank you again. And we're going to be posting this vidcast on YouTube, on our social media pages, and you can subscribe to the podcast Health+Tech on Apple Podcasts and Spotify. Thank you for listening.